Hello, everyone, and welcome to another episode of our CCC Spotlight series. For May VHL Awareness Month, we will be interviewing 4 separate medical professionals from the Comprehensive Clinical Care Center at Huntsman Cancer Institute in Salt Lake City, Utah. Huntsman will be hosting this year's VHLA Annual Family Weekend in October. Today, I'm excited to welcome Dr. Alejandro Sanchez. Dr. Sanchez is an assistant professor in the Division of Urology at the University of Utah School of Medicine and a Huntsman Cancer Institute investigator. He specializes in the surgical care of patients with urologic cancers using open, laparoscopic, robotic, and endoscopic techniques. Dr. Sanchez received his undergraduate degree from the University of Florida, where he graduated summa cum laude in biochemistry. He earned his medical degree from Harvard Medical School and completed his urologic surgery training at Massachusetts General Hospital. Dr. Sanchez then completed a fellowship in urologic oncology at Memorial Sloan Kettering Cancer Center, where he received a Young Investigator Award from the American Society of Urologic Oncology to evaluate the mechanisms underlying the association of sarcopenia and poor oncologic outcomes in patients with clear cell renal cell carcinoma. During his fellowship, Dr. Sanchez also received the Chairman's Award for Excellence in Basic Science. Dr. Sanchez's research efforts are primarily focused on clinical trial development and translational research. Dr. Sanchez, thank you for joining us today.
Thank you for having me, Josh.
So, Dr. Sanchez, when and why did you first decide to become a doctor?
So thanks for asking. It's a very common question that we get as physicians, and I think everybody comes into the field from a different point. For me, I grew up in Colombia, in South Florida. My father and grandfather were both agronomers. And when I went into college, I really wanted to be an engineer and started off as a chemical engineering major, and ended up one summer actually landing in a lab where I was doing research with a rheumatologist who had a basic science lab and also ran a clinic. And so I had the opportunity to work with him in the lab and also see patients in the clinic, and really kind of fell in love with the fact that he would come up with questions in the clinic about how to improve patient care and take some of those questions to the lab and try to answer them. And as I had more of an opportunity to volunteer and meet other physicians and find out about the different potential subspecialties, decided to change my major into biochemistry, and really not knowing what kind of doctor I wanted to be, but knowing that medicine and potentially research was the right track for me.
Speaking of specialties, what got you interested in urologic oncology and specifically VHL?
Sure. So I think like many others, the way that I ended up deciding on urology and specifically urologic oncology is through the people that we meet and interact with, and in medical school and in my residency, the people that I looked up to the most and could see myself doing what they did were urologic oncologists. And I really loved the multidisciplinary aspect of oncology, being able to work with medical oncologists, radiation oncologists, really to take good care of patients who can be very complex. I knew early on that I wanted to do urologic oncology in my residency, and kind of prepared for that, trying to explore some research in oncology, and ended up working at the Harvard School of Public Health with some of their big prospective cohorts evaluating some lifestyle factors and how they affect kidney cancer, the incidence of kidney cancer as well as prognosis. And so that got me really interested in just kidney cancer and the biology of kidney cancer. And, within urology, we have great leaders and examples of surgeon scientists like Dr. Linehan at the NCI, who I kind of looked up to as I was learning more about the biology of kidney cancer, and really wanted to find a fellowship where I could, increase my skills and focus more on translational research, and ended up at Memorial Sloan Kettering, where they do a lot of kidney cancer surgery, take care of a lot of very complex patients, including some VHL patients and other hereditary syndromes. And again, kind of solidified my interest in kidney cancer in general, as well as a population of patients such as VHL patients. So.
And by the way, that collaborative model that you mentioned is like exactly what we're going for with the clinical care centers, and with what we try and impress the importance of to patients. So thank you for mentioning that. What have been some of the more challenging aspects of your job, and what have been some of the more rewarding aspects?
Sure. I mean, I kind of come with a different perspective. So I just finished fellowship last June, and so I've just started as an attending, so less than a year of experience. And I think one of the most challenging things, kind of starting out, is that you have this tremendous responsibility of deciding when to do surgery on a patient, guiding them through surgery itself, potential complications, and patients giving you this tremendous responsibility to take good care of them. And some of the most rewarding things is really working with patients, again, in this multidisciplinary setting where they see our medical oncologists, radiation oncologists, and patients have good outcomes. I think some of the most challenging things are when, patients, you have to, carry patients through a complication or things that at this point as a trainee felt a little bit different compared to now being in charge. So I think really feeling that responsibility and feeling lucky to be able to take care of patients, but also having to guide them through difficult situations.
What has been your most memorable experience as a VHL specialist?
So again, I'm just starting out as an attending. Most of my experience has really been as a resident, as a fellow, but I can tell you that other than being interested in research behind kidney cancer and also VHL, from a population standpoint, I've seen in my training patients that have come in where they've had tumors at a young age, and they've had complete removal of their kidneys, and end up on dialysis, and partly because it was not recognized that they could have a hereditary syndrome that maybe needed to be treated differently. And so, that really made me interested in working clinically with a VHL population, really teaching and doing outreach, not only to patients, but other physicians and providers, to recognize the characteristics of VHL and trying to prevent things like that from happening in the future to other patients.
Thank you. Now, obviously, the state of VHL has changed so drastically in the last few years. How do you think it might change further in the next 5 to 10 years?
Yeah, I mean, I can give you my, from a urologic perspective, and we mostly, deal with renal tumors, adrenal tumors. I think we're learning a lot more about the biology of these clear cell kidney cancers. I think there will be a lot more exciting therapies, especially in the era of immunotherapy and targeted therapies. Dr. Mon will talk a little bit about an exciting clinical trial going on. And I think really thinking about kidney function preservation and kind of long-term outcomes and quality of life, focusing more on quality of life for patients from a surgical perspective, I think will be very important. And I think where I hope to contribute with my interest in lifestyle factors and how that affects progression of tumors, I think it could be applicable to a VHL population as well. And I think, you know, in the next 10 to 15 years, we'll really see more exciting therapies, but also think about some of these other things to improve quality of life for patients.
We always see our doctors are, you know, always in scrubs and in the hospital, but we want to, you know, behind the scrubs is a real person, and we like to get to know them. So I wonder, what other passions or hobbies do you have outside of the hospital?
Sure. So currently, as I was telling you, Josh, we have a 6-week-old daughter. So my last 6 weeks have been focused on family, and has been a lot of fun. I have a 2-year-old daughter and a 6-week-old daughter, and here in Salt Lake City, we've just really enjoyed being in the outdoors, and so love biking, hiking. Have been trying to get into fly fishing. So I think just to be outdoors is really what helps us relax and recharge for work. So
Salt Lake City and that whole area is really stunning. I think it's going to be. We're really excited to host the family weekend there. And so, speaking of the family weekend, for everybody that's going to be coming in from out of town, what would be your favorite tourist attraction that you think they just have to go to?
Sure. I mean, I think once you're in the city, I mean, you have access to amazing trails, even behind Huntsman Cancer Institute. It's kind of amazing. From my own office, I can see people mountain biking and trail running behind the office. So I think just taking some time to do a quick hike and get some beautiful views of the city. There's a good food scene, and I think it's important, especially these days, to try to support some of the local restaurants here. But I think you know, October, the weather will be beautiful, and checking out some of the local hikes, Cedar Creek Canyon, other places will make it worthwhile. Yeah.
Can't wait. Dr. Sanchez, once again, I just want to thank you for taking the time to join us today, as well as for everything you do for your patients and the VHL community.
Well, thank you very much for having me.
For everybody watching at home, you'll be able to meet Dr. Sanchez in person at this year's VHLA Annual Family Weekend, hosted by Huntsman Cancer Center at Salt Lake City, Utah on October 23rd to 25th. You can find more information about the weekend, including registration, at vhl.org/family weekend. You could also find information about other great May VHL Awareness Month events at vhl.org/May awareness. Until next time, everybody stay safe.